So Kylie was born in November 2008. Everything seemed normal throughout her mom's pregnancy. Everything normal, checkups. The one thing that happened was her mom had her water ruptured prematurely. And I believe that was at 24 weeks. And Kylie wasn't quite ready to come out yet, but mom had to stay in the hospital on bed rest for about 10 days. They said the longer that we left her in, the better. But still at this point, there was no indication that there was anything abnormal other than the premature rupturing of the membrane. So mom stayed on bed rest for, I think, about 10 days. And then we had a normal vaginal delivery with Kylie. Everything seemed normal. Nobody had any concerns or questions whatsoever. The one thing that we did notice when she was born was her tongue was sticking out. And I said, oh, look at that. She's giving us the raspberries. She's already got that attitude. So we kind of all laughed about that with the tongue. Started feeding her. The tongue was out. The formula, we were losing more formula that she was getting. So naturally, we were a little bit concerned. But everyone said, no, everything's normal. Sometimes that just happens. Carry on with your day. We were discharged, went home, realized more and more that this was becoming an issue with feeding. We were only able to get a certain number of ounces in each feeding. So we started doing some research. Enlarged tongue, because her tongue was not only long and out, but it was also thicker on one side. So it was kind of asymmetrical. So we started doing some research, and then she had pits in the back of her ears, a couple little marks. She had stork bite, not real significant, but enough where we noticed a little bit of a mark on her forehead. Again, each thing by itself, everybody said it's nothing. Mom did a lot of research, led us in the direction of BWS. Kylie at this point was only maybe about 5 weeks old, and we were told, wait till she's older, it'll fit in her mouth, everything will be great. Wait till she's older, and maybe we can always do genetic testing. Well, naturally, our first question was, what's going to change genetically between now as opposed to what do we wait? She's 1 year old, 2 year old. How old would we wait? And they said, well, we'll wait and see. I said, well, I think Mom and I both said, why wouldn't we just genetically test her now so we know? So we pushed. We had to be our own advocate for her since there was no concerns on anybody's level. So we pushed and pushed, and we got genetic testing. Sure enough, BWS was the diagnosis. So we proceeded then with the regular protocol as far as the screening every 3 months, blood tests, as well as the ultrasounds. Feeding, we just continued to just work around it. We put a rag around her mouth, tried to seal as well as we could, and we continued to see different ENTs within the 2 major hospital systems. We're from Cleveland, so world-renowned Cleveland Clinic. You would think, wow, we were in a great place. We have amazing resources. Unfortunately, that really wasn't the case. We ran into a couple doctors that we found we were educating them on BWS. Nobody seemed to really know a lot about it. We finally found an ENT that we really liked, we were very comfortable with, and his answer was, I've done tongue reduction surgeries before. And we kind of we were excited on one level, like we finally met somebody that knew about BWS and understood what it was all about. But on the flip side was he had done it before, where more and more, to take a step back, more and more of our research kept leading us to Dr. Marsh in St. Louis and his amazing team. So we decided we were going to go to St. Louis and meet with the doctor that did that, not had done it or had heard of it. That's what he did. And we did most of our consultations through email. We sent pictures, all the different information back and forth. We set up an appointment. Kylie was 8 months old when we had our consultation and subsequent surgery, since it was a bit of a drive. So Kylie at 8 months old did have a tongue reduction surgery, and everything went according to plan. The only complications we ran into was Kylie didn't want to feed. She didn't want to eat after. So that was a huge challenge. She did have to have a feeding tube. But to fast forward, and it seemed pretty significant at the time. Those couple days after surgery were pretty stressful. But fast forwarding on a month, 2 months, 3 months, we got past it. She was no longer on the bottle. Fast forwarding to speech at 2 and 3 years old, everything was normal. Her jaw was lined up the way it should be by several years old. Her teeth were coming in normal. Other than the fact that her tongue physically appeared to be bigger, there was really nothing that we were concerned about. Everything was going exactly as it should. So really, we had no concerns. So we did the regular protocol. We had 3 screenings every 3 months. We had blood tests and ultrasounds, what did we call the ultrasounds? Do you remember?
Jelly belly.
Jelly belly. Phenomenal patient. She was the best ever. She went in and actually had fun with it. We had nurses and doctors that really were phenomenal that took care of her. She got lots of stickers, yes. And that was the thing. She actually got to a point where she was looking forward to it. I get to go to Jelly Belly, and they would give her like a whole pile of stickers because she was so good with it. Our family very early on was very involved with us since we didn't have doctors to help us, and we were kind of navigating the waters on our own. Her mom doing most of the internet research. We became internet doctors. So while we did that, her grandmother on both sides of the family, her mom, and I all just did research, so we all talked about it together. Her mom and I were immediately on the same page with every step of the way as far as what to do. Yes, we want this tongue reduction surgery. Yes, we want to make sure we follow the protocol. So our family was very supportive of us throughout the process.
My dad was just talking to me about it, like at doctor's appointments. My mom would like tell my doctors about it, and I would just be like, oh, okay. Like, I caught on eventually. I heard people talking about it, like my mom and dad.
I think a lot of that goes back to us educating her caregivers. So if she had ear infections, we went for tubes in the ears.
She like carried around the CD, and she like at one point let me like watch it, and it like explained like what I had.
That's right. So the CD, and we would actually ask for extra copies, and we would give them to the doctors within the Cleveland Clinic and University Hospitals in Cleveland. So as we're explaining this to the doctors, she's sitting there like a little sponge, taking it all in too, little by little. And so I think it was a learning experience for everybody all the way around.
When I was in like 4th grade, I started going home early because I'd have like ear pain, and I would ask my teacher to go to the nurse, and I'd just be leaving like multiple days a week because like my ears were just hurting so much.
She always blamed on her ears, so of course naturally we go to an ENT, Minute Clinic. The ears are fine, there's nothing wrong. We're like, she has allergies. We went to an allergist. No allergies. So we were kind of at a loss and kind of just let it be for a while, thinking, taking Advil, maybe it'll feel better later. There was nothing to indicate there was anything wrong. We went to 2 ENTs, like I said, an allergist, her pediatrician. Nobody really saw anything significant that we could be concerned about. It wasn't until we went to the dentist that he did an x-ray, and he said, does she have any jaw pain? And they ask you different questions, and I'm like, thought maybe TMJ. And I said, well, actually, she complains about her ears, like here. And well, you would be able to tell me exactly where.
Right here.
Right. And so he, on the x-ray, say, well, the reason I ask is because I can see that she has arthritis in her jaw. So all this time we've been thinking ears, ears, ears. We were focused in on the ear. Here it was her jaw. We weren't even thinking jaw because we had the tongue surgery and their teeth and jaw were aligned perfectly, so we weren't even thinking anything with the jaw. But sure enough, she does have rheumatoid arthritis, not just in her jaw, but throughout her body. The jaw was where it was predominant. That was what was, and they said that arthritis in the jaw is the hardest to get under control. So she was on methotrexate for some time to try to get the arthritis under control. She had a lot of side effects from that methotrexate, nausea, stomach pains, not able to eat,
Being
dizzy very often, and yet her jaw still hurt, so it really wasn't helping. They noticed like her joints. Where was it?
My right knee had like
Fluid?
yeah, fluid. and it was like puffier and my legs weren't the same length. And I would like stand with my legs stuck out like
So we got it under control with the joints. The doctor was really happy with, her mobility and less pain, but we still had issues with the jaw, which was our original issue. So she did go through cortisone injections in the jaw. They did put her under anesthesia. They gave her cortisone, and it worked. Do you remember how old you were? It was at least 2 years ago.
it was April of 2021.
April of 2021. My advice for other families would be your child's advocate. No matter how well you know or respect the physician or their staff, you know what's right for your child. Be your child's advocate. Because I think that if we would have taken the doctor's advice, we wouldn't have known when we knew. I don't know. Would we have known at 3, 4, 5, 6 year olds? So, who knows? Nobody can tell. But I do know that her mom being the biggest advocate of we need to know now, right now. And mom was not going to rest until we had an answer.
Like look for it earlier. Like, like if you see like signs of it, like research on it, earlier on, like before your kid gets older.
Absolutely.
I feel like it's worse, right?
Absolutely. And then I do remember a kind of funny story about that is they said, all right, well, so with BWS, this is the protocol, and they talk about cancer screenings. Now the cancer word comes up, and now you're freaked out. Well, I think we can get her in like March or April. This is December. No, March and April isn't going to work. I'm here now. We're going to do a screening now. So I think like we had to wait maybe a day or two, but it certainly wasn't 3, 4 months. So again, that's being your child's advocate and insisting on the care for your child would be the best advice I could give.